Prosthodontics, better known as Prosto, where you do full mouth rehabs, implants, maybe even some facial, maxillofacial prosthodontics as well, where you're doing some replacement parts. All of this is part of the specialty of becoming a board certified prosthodontist. And we're talking today to a D4 who just matched at his top program. Stay tuned. Hey, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, surviving dental school, getting into residency, and then life as a new dentist. Guys, be sure to continue to not only sponsor the channel by liking it and subscribing, but also by sharing and leaving comments down below, which will be very helpful to get this information spread out, not only to your colleagues, but also to your other dentists or soon-to-be dentists all across the world. Also, this episode of Ask Dr. Darwin is being brought to you by GetIntoDentalResidency.com. Right here, GetIntoDentalResidency.com, the tool to help you match this cycle to your top residency program. For more details, go down below and enroll in one of the services to help you get into your residency program of your dreams. Okay, so hey, today we're talking with one of the three persons from the Occlusal Table podcast. So it's good to see you again, man, and also good to hear that you matched at your top pros program, and that's the topic of today. So guys, be sure that you stay all the way through. We're going to be talking about how he prepared his application, about pros as a specialty, talking about his interviews. We're going to talk about his rank list and the programs, and he's also going to give us some advice for you aspiring prosthodontics, future prosthodontist. So please introduce yourself for those that are meeting you for the first time, man. Tell us a little bit where you're from and what undergrad you went to as well.
Hi, okay. How's it going, people? My name is Bradley Iwe. I'm from Houston, Texas. I got a bachelor's in biology. Right now, I'm a D4, a graduating student at Meharry Medical College, and my residency is going to be prosthodontics.
Good. And we'll save towards the end. We'll do an actual pros program reveal as we get through all these questions, because people want to know, man. Pros is popular, but not as popular as some of the other residency programs like pedo and ortho and oral surgery. However, pros has a lot of different components, evidence-based, like I said, full mouth rehab. It's the foundation of a lot of things that we do in dentistry, especially as a general dentist, but on that next level. So tell us, why pros? Why did you decide on pursuing and going into pros as a specialty?
So, like dentistry, when I first got into dentistry, I definitely saw all the art, and then like as going through school, I started to learn about like process, pretty much the art and science between both like specialties, like because pros not only focuses on like the arrangement of how somebody looks or what aesthetics that the patient wants, but also to see if it's actually functioning correct. Can the person really bite? Can the person actually live with this for a very long time? Even if we get into the maxillofacial portion, it's can I be able to not only replicate exactly what the person wants to look like with a prosthesis, in their face, which I think is next level to me.
Yeah, and it's definitely it kind of mimics some of the plastic surgery that are medical components, and yes. I mean, and medical colleagues deal with, and you probably will. I know at the program that you're going to be telling us about in a little bit, they have a very intimate connection with medicine, especially with maxillofacial prosthodontics
Man,
as well. So just a lot on that, reconstructing people's faces and other parts of the head and neck area, which you wouldn't typically think that we as dentists do, right?
yeah, exactly.
Yeah,
I never knew that dentists actually do that. When I found out that like prosthodontics are the people who actually make the fake eyeballs, the fake noses, the fake ears. I was like, oh yes, this is the one. This is the
yeah,
one.
yeah, yeah, man.
Yeah.
So, when you apply to PROS programs, you have to have more than just one, right?
Yeah.
You knew it was PROS, but you also knew there's a handful of times 10 of different programs throughout the country. So
Oh yes.
let's talk a little bit about your application and what you did when you decided, from the time that you decided, or maybe even up to that point, when you decided that PROS was going to be the specialty for you. How did you start with your application from that point on?
I see. I think when my first inspiration of process started was when I think it was second year. We just got our introduction into like the lab, right? We were learning about gypsum. People don't know that's dental stone. What we use it to pour up things, and it felt like I was in some type of some, like a Dexter's lab that we're just making things. And so I was like, okay, this is pretty cool because I'm always been just want to be able to just use my hands for anything. Right? I love the busy work. So when it got to, oh, we were making crowns, doing the, what's it called, wax techniques and stuff, right? I was like, okay, you know what, this is nice, especially when I actually originally came in for oral surgery because I shot a lot of oral surgeons. I see a lot of like cardiologists, a lot of people in surgery in general, and I did like understand the physics when it came down to extracting teeth. But then as going through the process, I started to know that I naturally feel like a prosthodontist. I'll say that. Like I do like the oral surgery lifestyle and what they do, but I feel more at ease with pros being like what I want to do for life versus trying to be um, surgery constantly all day, every day, right? I rather if I'm going to
And
do
all
it,
night.
yeah, like 8 hour surgeries, people they don't even know about it. Um, but I think I'd rather be like, okay, if I'm going to do a surgery, let me try to do like the full aspect of it, right? So it's like,
Right.
okay, after I finish your surgery, right? What else can I help to, improve your lifestyle,
Yeah.
your
Yeah.
morbidity as best as possible? And I felt like process actually was the way for me. So that's when I started like having my interest in process. Then when I got into my application, I started off a bit subpar because it will be best for people to have like a catalog. I'll say, get permission from the patient. Take pictures for your before and afters, especially if you're making dentures, so you can show, um, your work. When you get into school, one of the requirements is that you have to have a professional camera. And first, I didn't think how important it was to actually have a camera, but after taking clinical pictures, the
Yeah.
before and after makes a huge difference.
Makes a huge difference.
Yeah, you could definitely see. You want to make it so natural that other people are fooled by it.
Yeah. Or
And
other people say, Dr. Bradley, that's what I want. That's how I want
exactly,
to look. That's what I want to look. I want to
hmm
look just like that. That picture,
just like yeah, just like that. They could pull
just
up a
like that.
picture, and I'd be like, okay, cool. We could try our best to try to replicate this. Um, but yeah, that's what I felt like. Pictures taking was definitely an important part of it. But service work and honestly, I think just a competitive application would be more of like, let's see how much work do you do with your hands. Two, do you have like your portfolio when it comes to your catalog for pitches? Three, tons of community service hours,
Hmm.
right? To me, I think that shows um, commitment because process like you're doing now everything. So from you doing the treatment planning, not only that you're going from treatment planning to operative, now operative to lab work, right? Yeah, so you're going immediately to the lab work. So now you're doing everything all in one. And after you have done the lab work, now you're doing the reevaluation to see like, okay, is everything in order? Because now if you mess up, you have to readjust it. You have to fix it up. I think the only difference between that and now like general surgery and like in cosmetics is that we pay more attention to like the science towards it. So if you have done like research with in process that's like implants, longevity and things like that, that also helps too. But I think one of the biggest things is if you're not confident in your hands, get confident, right? Be able to cut preps not only fast but also efficient. You want to be able to replicate something, on the spot. I think I was told by a prosthodontist in Houston, I had to be able to set teeth within 2 hours.
Yeah.
And for people who are just beginning to set teeth, a lot of people don't know that's not a fun. That's not a fun.
Yeah. Hey, this is Dr. Darwin, your new dentist coach. Hey, look, it's residency time. It's residency application time. And the biggest question that a lot of people have is, how do I prepare my application? So look, if you're struggling in getting your information together, your CV, your personal statement, or you're ready but not prepared for your interviews, reach out to me ASAP, right? Through my group, Dental Residency Headquarters, we can help you. We can help you get ready for this residency cycle so that you're able to do this. We want you to match into residency cycle this year, all right? But you got some work to do. If you need some help with that application, shoot me an email at newdentistcoach@gmail.com, newdentistcoach@gmail.com. And through our program called Get Into Dental Residency, we can help you. But you got to hurry up because residency application is right now. So shoot me an email right now. All right, let's get back to this episode. Well, tell me. I know there's some parts of your application that's not always going to be fun, but some of it had to been exploring and getting things together for your application. Did you do any type of extra type of externships or anything in school to add to your candidacy and your application? Like what other things did you do to help you prepare for your application?
For me, I worked and also I shadowed a lot. So I wanted to see the lifestyle with prosthodontists. So I shadowed 2 prosthodontic clinics and also worked at a general surgeon who practiced in prosthodontics.
Okay.
So I was able to be exposed to having a lab in the office and be able to do both things. And also seeing the lifestyle of the prosthodontics. I unfortunately did not have the opportunity to take the externship. I believe definitely if you have the opportunity, please take the externship. It gives you a taste of what it's like to be in that specialty. For me, I already knew that, like, for me personally, I already knew that I was living in the lab. It was going to be late hours. So when going to my interviews, I was able to be on good grounds with a lot of people because they know that, like, okay, yeah, this is going to be tireless time. So I'm already, pre-prepping.
Yep.
So I'm being able to know that, like, I may be home at 1 o'clock and be, in the morning at 5.
Right. Going back at it. Yeah,
no stopping. This is what is going to happen.
Yeah.
Because there's cases that you got to get it correct.
Because, you got to get it correct. That's true, man.
Yeah.
That's true. So how did you come up with your list of schools and programs? Because, there's new programs, and I know UPenn just got a new program maybe about 3 years ago. And then you've got some long-standing programs that have been around, over 50, 60 years. How did you determine not only the number of schools, but also which programs or schools that you wanted to apply to? Tell us a little bit about that.
So first, I initially wanted to go to a residency that's first paid. because this is going to be extra schooling. I definitely wanted to get a taste of what it's like to be like now I'm working with a doctor. There are programs that also don't have any stipend, but you're just going there for the education. I think when looking into programs, for me, I was into programs that wanted one, the culture of what it was like at school, to see if the school was family oriented, if the city was nice to live by, and the second thing would be the curriculum. How much time do they spend on certain procedures? Are they a heavy implant school? Do they specialize in new technology? Do they go through the old ways, the traditional ways? Or is it mixed? Do they try to do online dentistry with the old school ways? I saw my list. I didn't have any of like the top or high end, such as Michigan, Harvard, San Antonio, but I wanted to get closest schools that feel very close to cities, big cities, since I'm from a big city, and also was in new technology. So majority of my schools were heavy within new tech and also city life and culture. That's how
Yeah.
I chose my schools. Because I rather, if I'm going to be in a city to learn, I want to be as comfortable as possible.
Yep.
I believe, yeah, I think if I went to a place that was nice, such as Harvard, I'll be blessed to be there, right? You know, because of the namesake, and I know of course representation, but I don't truly believe that I will be happy. Right? If I did an externship there and I got a taste of what it was like, then maybe my mind would change.
Right. Right.
But I think that was the only thing that kind of sucked about the whole COVID thing. That externships were there, but there were not as many.
Yeah. Yeah.
But yeah, my application was mostly just as first was trying to get a paid residency and the culture.
Plus, keep in mind on once you become, once you do your residency in pros, there are opportunities where you can do a fellowship, right?
Mhm.
There's another thing I forgot what it's called, but a classmate of mine did one, something like a fellowship, but it was in implants. So there are opportunities once you finish your pros program to go to like a Harvard or go to a Michigan or
Mhm.
go to some of these other programs after you've got your foundational residency program over. And usually those fellowships are only just for like a year, maybe two, depending on what it is. But schools, how many schools did you end up applying to?
I applied to around, I think about 20 programs. I think 16 to 20 programs. I don't remember off top, but yeah, it definitely hurt. It definitely hurt, but it's one of the risks that you have to do because it's like you're
Part of the
competing against.
process.
Yeah,
Part,
it's part of the
part of the
process.
process.
Yeah.
And there's a lot of schools that are in a lot of programs that are in big cities or cities where
Yeah.
you can see yourself at, cities that have some good things going for not only the culture of the school but the city where the school is out in, and like you said, family and faculty, all of those things play a real significant role because those are the people and that's the environment that you're going to be in for the next
Hmm.
3 years, right?
Exactly.
Yeah. So after you got your school, you got your application together, then you started having some interviews. And I know for many people applying to residencies this past cycle, they were getting mixed. They were getting the virtual ones, and they were also getting
Mhm.
the in person ones. So, of those programs that you applied to, how many interviews did you get? And give us a little overview of some of the not too typical questions that you got.
Okay. Um, I got I was fortunate to actually experience both. I had the in person and also virtual. The in person was actually cool. You get you actually get to step into school, you get to see the lab, right? And then that's when the interview starts, right? You
Yep.
actually would do um, you have to draw a design, cut a prep, make a temporary. Then as soon as after that,
What? What? Are you
yeah,
serious?
Yeah, they're saying like, oh, on the spot, let's go. Yeah, you like the school? It's nice, right? Okay, cool. Boom. When the room hits, all right, everybody get ready. Cut your preps. It was
Wow.
cool. It was cool. It was like, and you're competing against a lot of people, not just people in America, but around the world.
Mhm.
I think that's for all residencies. So everybody's just cutting such a nice prep. Like, oh, this is nice. Yeah, this is great. It was cool. Then actually after that there was the interview. But then the virtual process, like the Zoom call, were very short, around maybe like 20-minute interviews. I had 2 virtual interviews, which were nice. Their questions was mostly like, okay, who are you? What do you like to do for a living? Um, how do you handle stress?
Yep.
What got you interested in pros? Some of the interesting questions was, what do you like to do on your off day? Like, just what do you like to do? And then another one was, if you seem a patient that is distressed, was not happy about your work, how do you handle
Right.
it? So they had questions that was more personal, which were kind of like I think the in-person were more personal. They read your application, they read your personal statement. Now they're just trying to see like, oh, you're a good fit with us. Do we like you? It was like, do you like us? Um, then the online interview, that one kind of felt more traditional, like kind of classic, right? Very speed dating like. So it's like,
Right.
okay, you got this much time, go.
Yeah.
Uh,
Did
it was
did
great.
you meet with multiple people, both with the in-person and virtual?
I met more people. I met more people in the in person. The virtual, it would be mostly either the coordinator or the yeah, mostly yeah, actually yeah, just the coordinator and then some leading doctors who want to come in. So most of my interviews were either like 1-to-1, and then I had around yeah, I had the other one was panel. So I
Okay.
had 2 other people that was with me. Um, kind of the panel one was also kind of a comfortable interview, but just to hey, who are you? How's it going? Right? What'd you do? We read your application. Kind of more of a conversation. The 1-to-1 was very okay. Now introduce yourself. Routine, and then after that, then it's like to me, I think the most important part was, do you have any questions? Right.
Yes. Yes. Always questions. And guys who are guys and gals, if you're listening, watching, you must have questions. There's no such
Mhm.
thing as I don't have no questions. That tells people that you know everything, which you don't,
Mhm.
and that's not your intention. But you should intentionally have at least 3 questions that you're gonna ask, even though you may not get a chance to ask all 3. But you need to go in there with some questions.
Oh yeah.
Yeah.
Definitely, because it's like I was saying before. I had to ask about like how the culture was.
Yeah.
Like how do y'all like you as faculty and the students? Are y'all together? Are y'all not? It's okay if it's not. It's just what do you want from it? Because you're trying to get
Yeah.
what you feel too. Because they know that you're interviewing them as well.
Exactly. Exactly. It's a two-way street. So you had some interviews, and then, how many interviews did you have?
I had only 3 interviews.
3. Okay. So, well, hey, that's 3 more than what you had last year.
Yeah, so I
That's 3
got it.
more.
Yeah.
So I'm sure after those interviews, some of those programs, maybe one could have stayed the same as far as where you ranked it. One could have gone up, one could have come down. Different things happen after those interviews. Tell us a little bit about how you rank those programs, and and why in that order.
Uh, so I ranked my programs on. I believe I ranked my programs on comfortability. So I had the choices between Houston, Rutgers, and Ohio State.
Gotcha.
Um, yeah. So each school was great. They had great curriculum. You get to learn both techniques. Um, Houston, it was just more of like on the technical side. They have majority of their stuff was technology, 3D printing. Ohio State felt like more of the it was very traditional, but at the same time you could feel the historic value, because a lot of people, if you certain textbooks came out of Ohio State.
Yes.
And so I was really surprised about that. Like, as soon as you go into the interview, there's this one room that literally has all the history of pros around it. I was like, oh, this is tough. This is really tough. Rutgers, classic. They'll teach you pros. Is like the old school way, but at the same time, they'll teach you on how to transition towards the new school. So when it comes to implants, you could do them, but they're mostly trying to get your hand skills right, understand the physics behind it, right? Really dive deep into the science. So I ranked mine I wanted the technology and the comfortability. So
good.
I chose Houston as my number one.
Yes, that's where we're going. There you go.
Yeah.
Nashville, going to back home to University of Texas at Houston.
Going back to Texas. Of craziest things that I applied to Texas, and during the first time I got an interview, and I think it was more like it's all right, my son. Your time is not now.
Yeah.
Your time has come. I'm like, okay, I'm back home.
That's great, man. Congratulations. Congratulations.
Thank you.
That's a big program, man. That's a very program that's integrated into that health science center that's there. And you guys will be doing, I know you'll be doing a lot of maxillofacial prosthetics. I'm gonna get you connected with Dr. Boldridge. She's down there, Dr. Iwe Boldridge, and then also Dr. Gassan. What's Gassan's last name? He went to University of Maryland, but he not only did the pros program there, but he also taught. He still may be teaching there too. I'll get you linked up with him as well. So congratulations, man. That's great news. It's a double whammy. You got to go back home, and you got your top program as well.
Oh yeah, it's going down.
That's great, man. That's great. So, other people want to have that same success that you have, man, especially with pros. Give us 3 or 4 tips, knowing what you know now. If you had, a D3 that's applying to pros from Meharry or from other schools across the country, what are 3 or 4 tips that you would, tips and advice, piece of advice that you would give them if for all these aspiring future pros residents?
I'll say one of the biggest things is be okay with long hours. If you're not comfortable with long hours, then pros is not for you, because you may be waxing up teeth. Not a lot of people like waxing up, right? And especially, it's not just one tooth. You're going to be doing the full mouth, depending on what the level of treatment that you're trying to do. Another one would be patience. My classmates. But yeah, patience is another one saying.
You mean patience as in you must have patience, or you must have patience as in people? Probably both.
Yes, because if you don't got patience, then you're not working.
Right.
And if you don't got patience, you won't get no work. So all of that. And I think the last thing would be is that if you are a true art lover, right? I'll say that if you love aesthetics, or not just being great with your hands. I know people who could do great things out of wax. I just recently seen a first year, right? Waxing up dolphins, little dolphins, rings, little roses. Like, those are the type of people that, if you love pros, now it's just like you could now transition that into the science of it. Yeah. And really see your stuff like blossom. Because when you could return somebody who has or suffered from oral cancer, right? So they lost a majority of their face, and then you could be able to really like replant their face, and they can look at themselves to be just like, wow, it's like nothing changed, right? You literally changed the life, right?
Changed the life.
It's a heavy heart.
Yeah. So being creative and being able to transform that creativity into the science and the transformation that you're going to have for that patient, and then heading that area either intraorally or extraorally. Must have patience, and must be, this is not a profession if you don't like working long hours and having to do a lot with your hands, right? A lot more than what you've done in dental school. And I guess if you don't like lab work, guess what? This ain't for you either.
if you're afraid to get dirty, don't even come across.
Right. Exactly. Well, man, I'm telling you, man, this has been very helpful. So proud of you. So glad, because again, like I said, Pros is not one of those specialties that a lot of people have been checking for, but it actually was one of the specialties that I had thought about when I was in the Air Force, and they were kind of pushing us to do a specialty. But I thought Pros for me, because it would just added so much more flavor to being a general dentist. It's like you're you're a super GP with so many much more skills and talents and ways that you can really help people. Occlusion, dentures, implants, makeovers. I mean, just every materials. You mentioned digital dentistry and all the things that are being done now that a lot of GPs do, that you will be doing as a Pros resident and also as a prosthodontist, merging the old with the new in digital dentistry across the board, man. So really excited for it. Glad to hear that you got into your program of your dreams, and we definitely want to follow you through this journey into Pros. How's that sound?
Oh yeah, go ahead.
Definitely. Okay, cool. Well, it's like I said, this has been helpful. And guys, check out these next set of videos right here. Hopefully these are helpful for you as well. And that's our time. Love, peace, and smiles. We'll see you on the next video. All right, Doc, take care. Thanks.